level, it is a good thing to keep in mind that a lot of careers within the field, and especially within mental health, are going to require at least a graduate degree, so a master's or beyond. Okay, so what are the things you can do with a bachelor's degree? Well, it's good to have an understanding of psychology in general, but if you have a degree in it, those prospects are looking like a few of the ones below. You can engage in social work, be a case manager for the state, the respective state that you're in. You can go back or stay in the college setting, work in administration, or be a part of the staff. So you can work in admissions, you can work in financial aid, be an admissions counselor or a financial aid counselor. I don't love that we use those terms, counselor, whenever an individual doesn't have a counseling degree, but that is usually what the colleges will call them, so that's how I'm referring to them. I may disagree, but I'm going to go along with their particular verbiage, so when you see it, you can apply for it. So you can assist students as they're navigating their federal aid, or as they're transitioning from high school to college, or you can sell your respective college. So if you're being like a recruiter, then you can go out and if you have an understanding of psychology, you can interact with people a lot more effectively, in my opinion, and maybe improve the overall enrollment count of your respective college. So something to keep in mind, but there are other avenues that you can get into. It's not just limited to admissions and financial aid. You can also get into business and marketing. Again, understanding humans, what motivates them to want to buy, to sell, to, just anything involving the human element of business and marketing is going to be really impacted by having a degree in psychology. Now, I encourage you, of course, if you're wanting to get into those particular fields of study, get a degree in business and or marketing, and maybe minor in psychology. But if you'd like to, you just find psychology super fascinating, you want to keep with it, by all means, get a degree in it, okay? And maybe minor in business or marketing, okay? Now, lastly, you can be a behavior technician, so you can assist these counselors or psychiatrists or psychologists in a clinical setting. Okay, so that's a few of the careers you can do with a bachelor's degree. Now, with a master's degree, now strictly in psychology, because psychology and counseling, those are they're related fields in that they kind of hover around the same information, relatively speaking. Psychology, if you get a master's degree in it, is likely going to be pretty research focused and less on the practice focus. Okay, so you're focusing on the research of psychology, whereas counseling, you are implementing a therapeutic approach. Okay, you're wanting to actually go into practice. Now, with a master's degree strictly in psychology, you can become a college lecturer. That's what I did. I have a master's degree in general psychology, so I became a community college lecturer. You can engage in clinical or experimental research, and then you can move that forward into a PhD at the respective college of your choice. Again, psychology versus counseling. Psychology focuses on research. Counseling, it can focus on research depending on your program, but more so what you're going to be doing is focusing on your internships and getting the adequate amount of hours to be able to sit eventually for what's known as your LPC, or licensed professional counselor. Okay, now the counseling degree is going to take at least 60 credit hours. Now, if you're going into like school counseling, the requirements are going to be potentially a little bit less, depending on the school that you go to. So it's not an LPC route, it's just a master's degree in school counseling, and you can be a guidance counselor at a local school. But if you're wanting to eventually get into behavioral or clinical and mental health counseling, marriage and family, things like that, then you are going to get a master's with 60 credit hours that can lead you to getting and being able to sit for your LPC after so many hours. So once you get your master's degree, that's really when the work starts for counseling. It's a bit of a process to become a counselor, and it may vary from state to state. But here in the state of Tennessee, it's about 3,000 hours after you graduate just to be able to sit for your LPC, okay? And so that's it. As you can see, it takes a while for these counselors to eventually become licensed, but they can still work in the meantime as they're getting their hours, and they can get paid for it. They're just not an LPC. They have to be under the supervision of an individual, okay? And something that people will ask me is like, do counselors prescribe medications, or do they diagnose you, or what's the difference between like a counselor versus a psychologist versus a psychiatrist? So I'm going to speak for the state of Tennessee specifically. Yes and no, a counselor can diagnose in our state. Now, if you're just an LPC, if you have your LPC, you cannot diagnose individuals. You can treat individuals and assist them through their mental difficulties, but if you want to be able to diagnose, you have to take a little bit more coursework, focus on diagnosing individuals, and that's called a mental health service provider. So you'd be an LPC MHSP. So it takes a little bit more hours, a little bit more training, things like that. But then counselors can, at that point, diagnose, but they cannot prescribe medications. And neither can psychologists in most states. Now, more states are allowing psychologists to prescribe medications, but psychologists, whenever we're referring to a psychologist, this is any individual who has a doctorate degree in psychology. So this could be a PhD, a PsyD, things like that. So they do have they're throughout their program, they probably have focused on, especially when it comes to clinical psychology, they've focused on treating individuals, but they cannot prescribe medication. They can treat and diagnose, but unfortunately cannot prescribe medication because we have psychiatrists for this. Psychiatrists are individuals who have gone to medical school. They have a medical doctorate or a doctor of osteopathic medicine, a DO in psychiatry, and they're able to diagnose as well as treat individuals. So that's the main difference. Counselor can treat, cannot prescribe medication. Some can diagnose. Psychologists, they can diagnose and they can treat, but they cannot prescribe medication. A psychiatrist can kind of do all of that. They can treat, they can prescribe medication, and they can diagnose. Okay? And there are multiple, labels of psychologists. Like I said, clinical, experimental, social, developmental, counseling, sports, so on and so forth. Now, if that wasn't enough for you with a doctorate degree in psychology, you can also become a college, university, or professor. So all you need is a master's degree with 18 hours in your respective field to become like a lecturer, or at a community college, or maybe even at a university you can become a lecturer. But to get a better chance of becoming employed in a college or university setting, especially at a 4-year university, a PhD is going to likely be a safe bet for you, is what I'll leave it at.